Historically, if you look at the industry in general, you have, a history of digital health solutions being, sold directly to consumers, essentially. A couple of years ago, though, the new wave of delivering and commercializing, digital health products rose. So that's sort of prescription digital therapeutics and reimbursement models. One came here in Germany, in Europe, for instance. There's been sort of talks in the US about that for a long time. So I think that there's a big wave in connection to that, this new opportunity of essentially copying the pharma model of delivering these digital medications and getting reimbursement from them. That was really attractive from that industry, and many investors jumped on that. 2.5 years ago, there was a lot of hype regarding this new model of getting reimbursement and prescription-based digital therapeutics. Now we are a little bit in a downturn, I think. One of the pioneer companies in our industry, Paratherapeutics, went bankrupt this year. And I think investors are a little bit more hesitant in believing in this concept of getting reimbursement and getting prescription out there on scale, because I think it's proven to work on a small scale. We haven't seen that full adoption yet that we had anticipated as an industry, and also the investors. So I think that's really what we're sort of in a little bit of a limbo, waiting for it to happen and to really grow. And now many investors are taking a step back and looking at what are the other sort of options and alternatives to commercialize these products, because the problem is still there and the solutions are still great, but just changing this big industry of getting doctors to actually get educated on these products, get prescription out there, educating the patients, is much tougher than we would have thought. I think first and foremost you have to appreciate that the industry is an old industry. Things have been done in a similar way for a very long time. Coming up with a fundamentally different way of viewing what medicine is and how medicine can be delivered, not through pills but actually through apps, for instance. That shift is a fundamental shift for healthcare practitioners. And you see some adoption at the local levels or some a generation of HCPs, but on a really big scale, there's still a lot to be done. So I think that's the challenge, just to change their mindsets, getting them to do something they've done for a long time differently in prescribing these things, right? And the second thing is about understanding the evidence behind these products, right? So what does it mean to have it clinically validated? What does it mean to have run several clinical trials on these apps, to have it CE marked or FDA approved? It's very difficult for a doctor to know what that means. And if that, they have to have this full comfort and reassurance that if they actually recommend or prescribe something to their patient, that it will actually work in the end, right? Final point is just the time issue, right? When will the doctors who don't even have time to see their patients today, when will they have time to get educated on the difference between one DTX over the other DTX, to sort of get the information that they need and confidence that they need, and then in turn spend time with their patients on educating those patients? There just isn't time enough for that.